Dr. Simons, a vascular surgeon at UMass Memorial Medical Center. On behalf of our team, I want to thank you for choosing us for your care. At UMass Memorial Health, we believe that this is the best place to get care and the best place to give care. The following video will help you better understand what will happen before, during, and after surgery. Thank you for trusting UMass Memorial's Division of Vascular and Endovascular Surgery for your care. In terms of your preoperative planning, after you've made the decision to have surgery, our office will reach out to you to confirm a date for surgery and to give you additional information about what will happen before surgery, including your pre-surgical evaluation. About 7 to 14 days prior to your surgery, you will meet with our pre-surgical team at the Memorial Campus at 119 Belmont Street in Worcester. During this appointment, you will meet our anesthesia and nursing teams. You'll have lab work completed, have an EKG done if needed. We'll review your medications and health history and give you a physical exam. Be sure to bring an up-to-date list of medications with you. We will review what to expect during your procedure and ways we will take great care of you after your procedure. You will get a phone call the day before your surgery with an arrival time. This usually occurs sometime between 6 a.m. and 11 a.m. We will explain when to stop eating and what medications to stop taking or keep taking before surgery. If you're on blood thinners, this plan should already be in place prior to your procedure, as you may need to stop taking them depending on what type of surgery you are having. In terms of the day of surgery, you'll come to the university campus at 55 Lake Avenue North. You will use the Remillard Pavilion main entrance and follow the signs to the D elevator to the second floor. This is the surgical admission area where your family can wait during surgery. When you arrive, you'll see the nurses and the anesthesia team. They will place IVs, possibly a line in your wrist that measures your blood pressure. Your vascular anesthesiologist will make sure that you are very comfortable and send you off to sleep. Your operation can last anywhere from 4 to 6 hours. After your surgery, your surgeon will reach out to your family to let them know that you're doing well and in the recovery area. We will let them know when and where they will be able to visit you. Post-operatively, you'll go to the post-anesthesia care unit or directly to your hospital bed, depending on your operation. Our vascular team, including nurses, patient care associates, and case managers, will be with you throughout this process and begin to help plan your discharge. Some mild discomfort can be expected after surgery. Medications and other interventions can keep you comfortable. It's not unusual to have some numbness at the surgical site also. This usually improves over weeks or months. After surgery, we will ask you to move around as much as you can tolerate. This improves circulation and helps prevent complications after surgery. We implemented an eye cough practice to help prevent pulmonary complications such as pneumonia, blood clots, and other lung or breathing problems. The I in eye cough stands for IS device. This is your incentive spirometry device. You'll learn how to use it, which is critical to your recovery. The C stands for coughing and deep breathing. You want to do this several times a day to help your lungs expand. O stands for oral care. Brushing your teeth and using mouthwash should be done twice a day. U stands for understanding why these steps are important to your recovery. G is for get out of bed. We want you to get up and moving as soon as possible to help prevent things like blood clots from forming and to help speed up your recovery. H is for having the head of the bed elevated at least 30 degrees to help you breathe. Our team will make sure you and your family have all of the tools available to help prevent complications. Your commitment to your recovery is very important. In terms of your discharge, our office is going to call you about 48 hours after you're home and ask you a series of questions regarding your recovery and allow you an opportunity to express any concerns. A nurse practitioner or your surgeon is available if any concerns need to be escalated. Once you go home, you may resume normal activities as you feel you are able. You should be up and walking around your house several times per day. Walking outside and doing stairs are acceptable, and you can increase your activity as you can tolerate. Avoid aerobic exercise other than walking until your follow-up visit, which is usually about 2 weeks after your surgery. You may return to work or school as you feel you are able to do so. There should be no driving for 24 hours after surgery and never while taking narcotics. If you have dressings over your incisions, keep them clean and dry for the first 48 hours. Don't shower at this point. After 48 hours, you may remove the outer bandages over your incisions and shower. You should wash and dry the wounds gently with soap and water. No dressing is needed after 48 hours. Don't soak in a tub or a pool though for at least 2 weeks following surgery. As far as your diet is concerned, there are no restrictions. You may want to start with small portions of bland foods that are easy to digest for the first 2 to 3 days. You should keep well hydrated as your body is recovering. Try juices, water, broth, sports drinks. Having surgery and taking narcotic pain medications can cause constipation. Here's what you can do. Start taking a stool softener, Colace, or generically Docusate sodium, starting the day before your surgery. You should take 100 milligrams of this twice daily. If you go more than 2 to 3 days without a bowel movement, you should take 2 tablespoons of milk of magnesia 3 times per day until your first bowel movement. We're here for you 24/7. Please contact us with any questions.
Hi, my name is Deja Judelson and I'm a vascular surgeon. I would like to talk to you today about your AV access procedure. The procedure, also called arteriovenous fistula surgery, is done to create a permanent place to access your body's circulatory system in order to perform dialysis. Dialysis removes waste and extra fluid from the blood when your kidneys can no longer perform this function. An AV fistula allows blood to flow from your body to the dialysis machine and then back to your body after being filtered. AV fistula surgery involves sewing together an artery and a vein, usually in the wrist or elbow area. This creates a larger, tougher vein that can tolerate multiple needle punctures that are needed for dialysis. You can see the thickened vein and even feel a pulse in it after the AV fistula heals over several months. If you do not have veins that are large enough to use, other options include an AV graft, which is an artificial blood vessel. Often the AV graft can be used right away for dialysis, while the AV fistula will require about 6 to 8 weeks before using it. Your surgeon will evaluate which option is best for you. Donna D'Agostino is our amazing AV access nurse practitioner, and she'll discuss what to expect after surgery.
Thank you, Dr. Judelson. After your procedure, you'll be immediately taken to the recovery area. The nurses in this area are wonderful. The recovery room will be closely monitored for at least a few hours, specifically making sure that you are comfortable and your vital signs are stable. You will be getting pain medication through the IV if you need it. You can expect to hear or feel a buzzing or humming sensation on your access site. This means that your access site is working and there is adequate blood flow. This sensation will normally increase over the next few days, so don't be scared by it. You can expect to go home on the same day of your procedure, so be sure you have someone to drive you home because the anesthesia will make it unsafe for you to drive. When you are discharged, you will get instructions about caring for your access site, your medications to take, instructions for your follow-up appointment in the office, and what important signs and symptoms to look out for. If you work, you'll be out of work for about 1 to 2 weeks, depending on what type of work you do. The exact amount of time is hard to say. It's a little different for each person. Often we will give you a squeeze ball to use at home. This will help strengthen your fistula and help it mature. After the procedure, you will no longer be able to have any blood draws or blood pressure readings taken from that arm. Showering is okay, but make sure to wrap your arm in plastic. Tape it well to protect the access site and keep any moisture away from it while it is healing. Our office will schedule an appointment with you 1 week after surgery and then 6 to 8 weeks to check to see if your access is ready for use. We like the dialysis centers to use it 3 times successfully. If you have a tunnel catheter that you are getting dialyzed from, we will pull the catheter after the 3 successful uses. Is there anything else you'd like to add?
Thanks, Donna. We do want you to look out for certain symptoms after surgery, and you should call our office if you have any of them. This includes redness, bleeding or drainage at the incision site, if you have any excessive swelling. Mild swelling is normal and should improve with elevating your arm above the level of your heart. If you develop fevers, chills, or any newer concerning symptoms, we'd like to hear about it. And if you develop any numbness, coolness, or tingling in the hands or fingers of the arm where you had your procedure. Again, we would like to thank you for choosing the UMass Memorial Health's division of vascular and endovascular surgery for your care. We are here for you 24/7, and please do not hesitate to contact us with any questions at all.